very, very warm welcome to all and to my very special guest and a dear friend of now, I think, over 10 years. Dr. Sonia Copeland is the retired director for health prevention and protection, integrative for Jamaica, of course, integrative medicine practitioner, public health lecturer at the Northern Caribbean University. Dr. Copeland, welcome to Thrive Weekly. Finally, welcome to.
Fine.
So good to have you on. This will be our second video newsletter. So I'm so excited to have you on this call today. Can you please expand a little bit more about your experience?
Oh, I've had over 30 years working in the public healthcare system. But luckily for me, I have so many friends who are dedicated and committed to alternative, what we call CAM, complementary and alternative medicine. So I would say for about the last 15 years, I've been going to the seminars and going to the workshops, and I have resolved within myself that this is not a either or, but we have to integrate. We have to know when what works with what. So I have been practicing medicine for a long time. But my passion, I would say in the last few years, have been towards self-care. What can you do? Not that you'll stop going to your primary care physician, but I think if people get very clear, simple, and practical instructions, they are willing, to do what they can to improve their health. So that is it. I lecture, public health, and the master's program, I coordinate that at Northern Carolina University.
And in those 30 years of medical service and public health, you've seen a lot of instances of chronic stress. Why do you think that awareness is really the first step in reclaiming our health?
So what I say to that is that I think we have enough evidence. We have clinical evidence. We have the evidence of community health and world health. If you sneeze, your neighboring country sneezes. So it's easy for you where you are to get the cough or the cold.
Right.
So I think we have enough evidence that says, yes, lifestyle impact. Not that it causes it necessarily, but it certainly can accelerate a process that's there, and it can even exacerbate illnesses. And years ago, we spoke more about the nutritional related chronic diseases. But today we're speaking more about lifestyle, because lifestyle takes in much more than that. How you handle stress, how you eat, your efforts to eat in a very healthy way for you and your family. We talk a lot now about physical activity.
Right.
And of course, we know the things that the smoking and the alcohol, that these are not helpful, and persons should seek help, for these habits, to see how they can wean themselves off the very, very addictive nicotine and also alcohol.
Right. And I'm guessing, especially when we think about younger people, even us, Dr. Copeland, we are so plugged in today's environment to devices. Even now, we're having a conversation long distance on devices.
Amazing.
And amazing. I think about 20 years ago, okay, folks, don't judge me. And I'm not dating myself. 25 years ago, maybe 30 years ago, we didn't have this facility. But in today's environment, we are so plugged in. We're plugged in as soon as we hop out of bed in the morning. We go all day, we're scrolling. And I remember, I can't remember who exactly said it, but they were saying that we weren't really designed to be on, like plugged in 24/7. And that creates another level of stress because yes, we've got work to do, we've got kids to take care of, we've got family members, we have other responsibilities, but this being plugged in, that's just a whole other level of stress. How
It is.
does one, to your mind and in your vast experience, how do you get people to take that time, unplug, let's say, a little bit so that they can reduce the levels of stress that this constant addiction, I call it, to
Yes, it
devices?
is. It is. Well, it may be, I'm just thinking it through as we are talking about it. It may be easier for us, Chris, baby boomers to do that. Because there is a lot of help with that as well. We know that a lot of screen time isn't good for so many reasons. It
Yeah.
isn't good because of the sedentary lifestyle that it pulls you into that. It's not good for your eyes, the blue screen and all of that. So there are suggestions, walk around every 20 minutes, um, for the eyes that you relax your eyes by getting up and looking at, visions, objects that are far off. So you're allowing the lens of the eyes to relax and contract and to relax. It's elongating and it's, so a lot of things like that. Beside your devices, you can have like one of those miniature cactus plants because it's helping to absorb, radiation as well.
Wow.
In some business places, well, they have the option for their employees to be on a treadmill while working, or just to be standing. So you have
Yes.
something like a podium and you're standing and you're doing your stretches. I remember years ago when we were looking at workplace wellness, we said we could even institute, a sort of ring that reminds person it's time to get up, stretch. It's time to get up. So I think in a clever way we can do it. With the younger generation, though, this attachment, they just seem to be always plugged in, always plugged in. And they're seeing some adverse psychological behavior if you try
Mm.
to take away their devices. It's very complex.
Wow. I totally understand you because as you know, I have two millennials and I've seen the way they use their devices. Um, but I think because we are constantly having these kinds of conversations, and I encourage others, parents, to have these conversations with their young people so that they just give them a bit of their wisdom. It's good to come off the thing for a little while because this is what you're doing negatively on your mind, just not your mind only, but your brain, your body, everything is
Everything.
connected. Yeah, absolutely.
Right.
Yeah. It just brings me to another question because many people feel stuck. And you talked about making that decision, that complementary medicine. It's not one or the other,
Mm-hmm.
and so many
Right.
people feel stuck between traditional medicine, conventional, allopathic, and alternative approaches. What role do you see some of the latest cutting edge technology? Certainly, you have had experience with some new technology over the last few years, Dr. Copeland, like hydrostat and glutathione delivery. How has that played a critical role in your own personal wellness and that of others in your circle?
Well, I think the person who is naturally curious,
Mm.
and also another important trait is that you remain open.
Oh,
You
yeah.
remain open to new information, different information. So we know we have different systems of medicine. And what has been happening is that a lot of the Eastern practices have made their way into our Western society. And there have been important persons like Deepak Chopra and others who, have studied in the US, but they brought with them their traditional medicine, their traditional health, spiritual practices. So
Right.
we find that it's getting more and more popular. But we're not there yet, Chris. We're not there yet. The general public, not at all. And so it is persons who have been open to hear about energy, energy medicine and what it does, or cellular nutrition, or to listen and try to, process when we're talking about the battery cell, which is called the mitochondria.
Oh, yes.
Yes, and the shortening of the telomeres on the chromosomes. That when we look at young subjects and older subjects, we have seen that, with age, we have diminishing amount of, certain things. For example, the glutathione, this master superb antioxidant made up with, with three amino acids.
Yes.
As we age, it's getting less in the cell. And an interesting conversation I had with a researcher, medical researcher. He said that it was during COVID when they looked at, you remember initially we were
Yes.
losing our elderly, and when they did deeper studies, they found that these persons had low levels of glutathione. Very important. So,
Yeah.
yeah, so similarly, the mitochondria, the other things and so forth, diminishing amount as we age. And of course, lots of studies, they go back to those countries or areas in countries, for example, Japan and Eastern Europe, where persons naturally surpass age 100 and just studying their lifestyle, what they eat, what they do, how they socialize and all of that. And they have been putting together, for longevity, for regeneration, a playbook, if you will, of
Yes.
what it is that these persons are doing that we should try and incorporate.
Well, I want to add here, Dr. Copeland, that we talk about incorporating, the migration now of Eastern medicine into Western society. But I will also say that, remember, as Caribbean people, we have a deep history of African, the medicines, the food, etc.,
Folkloric, yeah.
from the continent, which is the African continent,
Yes.
and in those countries as well. I was doing some research recently, and I saw that there are certain tribes in Africa, because of their diet, their gut microbiome is so
Ah.
diverse. And
Mm-hmm.
these people have really, they live great lives. And some of us in the Western society, we talk about the SAD, which is the standard American diet.
Yes.
We are challenged because our gut biodiversity, it has been diminished.
Yes.
So we have Eastern, and I know a lot of people are now going back to Africa, bringing those foods back into the Caribbean. It's ancestral for us, right?
These are exciting times. These are, that fusion.
Yes,
Yes, that fusion of customs and tradition.
absolutely.
Yes.
This brings me to another point because when you were talking earlier, you talked about, the allopathic medicine, integrative medicine. It should not be one or the other because they can work hand in hand. And this brings me to this next question. So oftentimes we speak about people being partners in their
Ah,
own health and wellness.
so important. Yeah.
Yeah, because I have friends now, they're going through, whatever challenges they're going through, and they are determined to get as much information as possible so that when they sit with their primary healthcare providers, they can ask intelligent questions. What do you say to someone who feels a little bit intimidated about going to their doctor with questions and feeling, in the past we thought the doctor knows everything, whatever the doctor told us, we just follow the
Yes.
instructions. What would you recommend to someone saying, I have so much information at my fingertips and I want to introduce some of these questions in terms of my own healthcare with my doctor? What's a good approach?
You know, I'm thinking that it is really medical and general health professionals that need to adjust how we interact with our clients, with our patients.
Right.
Because the burden ought not to be on them, you know, to the correctness, in terms of needing to ensure that their care provider understands what's happening. We are the one, you know, that will have to facilitate that. But anyway, that being said, Chris, it's important. I remember in my earlier days practice, I've had a couple patients, after we have greeted each other and so forth, and they sit down, and they pull out a long sheet of notes that and then they go, sort of line by line to make sure that the time that they spend with me is well spent. And,
Right.
I chuckle now, but I totally understand why they need to do that. And so, what I would suggest is that organize yourself, before you go. Just think about, because questions we're going to be asking you is how long, you know? Have you been feeling this way? How long, we're going to also ask whether there may be family history. So just sort of organize
Right.
your thoughts. And we want to know what gives you relief or what makes the symptom worse. So it's patient education, and I'm so into that, to just help persons to, with that sort of what we call health literacy, and to be able to communicate what it is that they are feeling. But as I said, we in the medical and the wellness establishment also need to speak in a way so that persons can comprehend. Also help to elicit, to extract from the patient what it is, that's concerning them. So because the word doctor is teacher, right?
Ah.
Yeah. So we're so hurried and rushed and, all this sort of thing. But there needs to be a change, I think, in the state of code where, you've come to me and I have all the answers. I have learned so much from my patients. So that is important. You can just make a little list if you're that way inclined, or just think about the things that you want to tell us. And like I said, there are some things that we're going to ask. How long have you been feeling this way? What makes it better? What makes it worse? Do you have family history? Is anybody else in your family having these issues?
You just give me a really good idea. You've given me the idea of putting together a checklist and
Yes,
sending it out to everyone. Like, okay, when you're going to the doctor, here's a checklist. fill it out and walk with this.
That's right. I see myself as a patient advocate, and
Absolutely.
that would be a good thing. Yes.
Wow, wow. Recently, I had the pleasure of hearing you speak on a global platform for health and wellness, and you really delivered some amazing tips for anyone can incorporate in their life so that I won't say mitigate, because mitigate may not be quite the right word, but really to incorporate into your life, anyone's life, so that they can find balance, because I know what the body needs is homeostasis, which is balance.
Yes. Yes.
Um, some of these tips are really amazing. And so if someone watching this conversation when it's dropped on Wednesday, if they wanted to start making some of these better choices, what areas would you suggest they look at first? Because I know that there are many, but what are some of your top tips for helping to shape a more dynamic, vibrant, healthier lifestyle?
Okay. So some of the common concerns persons have out there is, weight management is one.
Oh, yes.
Yes, weight management, because they know they need to eat healthy. They know they need to, we all do, know that we need to exercise,
Right.
eat, and so on. Persons talk about time. I don't have the time. Yes, I know. I should be having more plant-based foods in my diet. But what I have to say in terms of the weight management, sometimes if you change one little thing, right, then you can accrue a lot of benefits where that is concerned. Some persons will say, okay, I'm going to reduce or eliminate sugar, you know. And remember, you have the natural occurring sugar, and you also have the sugar that we add. Or they may do that with salt. But one thing, I'm going to try and do everything one time. You're going to put,
Yes.
yes, one little thing. It may be to drink more water. And there's a debate raging now that, eight water, 8 glasses or 8 cups, that might be too much. You're diluting digestive enzymes and so on. Drink until you feel hydrated. And you're hydrated. You can look at your eyes, right? Just lower
The skin
eyelid,
here.
right? And if it looks moist and so, stick your tongue out, you know. Um, if your tongue looks dry, then that is a red flag. You are dehydrated. And sometimes
Yeah.
our skin helps to remind us, but also cognitive function. I just find that, oh, I just feel so out of it or whatever, you know. We know we're having a heat wave, and so it could be that you need to be hydrated. So I would just say one thing at a time. So we know it's the weight management, what we ought to do. We know with physical activity, I heard one of my mentors years ago, she said it. She said, you may not lose the weight, but try maintain it.
Just try.
Try and maintain it. Don't put on anymore. And as you can imagine, I felt better about myself. I felt better about myself because we all not going to be like Twiggy. Um, but we just have to try. Our lifestyle isn't making it any easier. It's a small percentage of persons who can commit to going to the gym, working out. Not many of us are going there. The cost, and again, the time. And
Yes.
it's not a natural part of what we do. So we say it does increase physical activity. If you can't cope with the gym fees and the profiling, increase physical activities in and around the home. So those are some of the tips that we give. And for stress reduction, stress management, to thine own self be true.
Amen.
That word, yes, yes, I'll do it. Yes, I'm on it, gets us into a lot of trouble. And we must be honest with ourselves. We can't do everything within the time that persons are expecting us to do it. So you have to learn to delegate if you have that option. And we also have to get comfortable with the word no. So sorry.
Yes, absolutely.
No. And I struggled with the statement that says the stress we endure and experience, a lot of it is of our own making. What? Yes, it is. You know, we have deadlines that others try to impose on us, but we are also doing some crazy stuff, that's not helping us to normalize our stress. So, always making a list, it helps for some persons. And the priority, everything cannot occupy priority one. This is the first thing I'm going to do.
Yes,
I had
absolutely.
Chris, I had another mentor that said, get the harder things out of the way first, right?
Yes.
That worked for her.
Yeah. And everything that you shared there, I mean, like lots of people have their notes and their to-do lists on their digital, they've got it on their phone. I still like the written thing.
Aha.
I've got my list. I go through my list and I check off as I go, and whatever I don't get to do on the day, I look at my list. I said, I
Yes,
got a good lot of stuff done. And
yes,
I just
yes.
everything that didn't get done today just gets shifted on to the next day, prioritized, and
The
that's
sky
it.
isn't
Because
falling. Yeah.
exactly, because I was sharing this with someone else recently. I said, I suggest writing. There's something magical that happens when you put pen to paper
Yes.
and you get those thoughts from your brain, which is like something we are going to talk about. I'm going to talk to you again. We are going to talk about brain health and cognitive decline, which is
Hmm.
it's a huge challenge.
Big
Um,
conversation.
Big, not for us to complete in this little time, but I'm going to invite you back because there's
I
something
love
that is
that.
critical. And I know I have several friends. My mom, I mean, I will just let everybody know, like my mom is forgetful. And I know she's experiencing cognitive decline. So when she asks me the same thing in a short space of time, I remember in the earlies, I would say, but mom, you asked me that already. But I've gotten to the point where her happiness is more important than me being right.
True. True.
So now if she asks me the same question 3, 4 times, I pretend it's like the first time I'm hearing the question. I go
And
like, oh yeah, yeah.
enthusiastically respond.
Yeah.
Yeah.
So
Yeah.
when did you, Christine, when is so and so? And I go like, oh, it's so and so. And she might ask me again twice for the day, and I will just give her the same answer because
Mm.
happiness is more important.
It
But
absolutely is.
cognitive decline is something that has been ramping up in our communities globally. I know that I looked at a short video last night and I saw right now we're looking at what, more than 50 million people worldwide, is it?
Mm.
Or
Oh,
is that or is
I
that
don't know that stat.
or is
Yeah.
that only in the US? Anyways, I remember the number 50 million. And so every single household, there's
Is
someone
yes.
who's
Every
touched
is impacted. Yeah.
exactly by
Mhm.
cognitive decline. So I'm going to ask you to come back. I have loved this
I love
conversation.
that. I love that, Chris.
Thank
I
you
love that.
so much,
Mhm.
Dr. Sonia Copeland, for this. I did tell you, and I did tell my friends, we're going to have a lively conversation. When the two of us get together, we have a blast every single time. And, just something that struck me when you said, all of us can't be twiggy. And I
Mhm.
discovered that not everyone who is thin is really thin because they too have fat that you can't see. And that fat, that layer of fat, could
Yeah.
be making them sick as well.
Yes. Yes.
So
Maybe the
it's
fat is around the organ, visceral fat.
That
Yeah.
is correct. So there's a lot we're going to talk about the next time we get together. Again, thank you so much for agreeing to hop on this evening. And we will get together again really, really soon. Thank you.
Thank you for great conversation.